This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So we will go ahead and get started. So I am Kristen Davis. I am a PGY4 at University Hospitals. We're over here in Cleveland. I am the chief resident this year. And we've also got my good friend Courtney here. I'll let her introduce herself.
Hello, I'm Courtney and I'm a third-year resident here.
Yeah, so excited to talk about our program tonight. Oh, maybe if I can get my slides to advance. There we go. All right, so just want to start out with a beautiful picture of our downtown campus. So this is located in downtown Cleveland. And this is where I'm located right now. I'm on my consults rotation. So it's beautiful and we'll talk about it a little bit more. So our program, we've been around since about 2016. We are a categorical residency program, which is really nice because you can come here for all 4 years. You don't have to move after a transitional year. You don't have to learn a new EMR. It's nice to just stay in one spot for 4 years. We've got 3 residents per academic year, and we are AOA, so we are osteopathic and ACGME accredited. So kind of run through who our faculty is. So this is our program director, Dr. Parnell. So he's dual board certified in PM&R and sports medicine. And he is the inpatient rehab medical director at our Avon location, which is on the west side of Cleveland. This is Dr. Schaefer. He's the division chief for PM&R. He is PM&R and sports medicine trained as well. And he's also one of the associate professors for orthopedics for Case Western, which we are closely associated with. We've got Dr. Gazzillo. So he's one of our interventional spine fellowship trained providers. He trained at Cleveland Clinic. He does a lot of interventional spine, fluoroscopic procedures, and MSK sports. And he is also kind of newly the interventional spine and musculoskeletal medicine fellowship director for the fellowship associated with our program. This is Dr. Trickett. She is the CMO for the Western Region Hospitals of University Hospitals. And we get to work with her at our Parma facility, which is kind of southwest of Cleveland, on the inpatient unit. Dr. Sorrells, she is our guru of all things outpatient PM&R. So she sees a lot of interesting patients. She does a lot of Botox injections, ultrasound injections. She sees a lot of traumatic brain injury, spinal cord injury, stroke, and she kind of serves to help the rural population around Cleveland. And then this is Dr. Thompson. So he is at our Beechwood inpatient rehab facility, which is on the east side. And that's where we do most of our inpatient rehab months. So we really get to know him really well. So kind of looking at our curriculum. So for PGY1, again, this is a categorical program. So everything is all located, you would do all 4 years here. So it has much of the same things you would see at other programs. I just want to highlight a couple of different things. You only end up doing about 6 months of inpatient, which is really nice because some programs you end up doing like a full year of inpatient, but this lets you get some of that outpatient experience, which is really nice. We do trauma surgery at that downtown location that I showed before at the CMC. That's our main clinic downtown. And that is a level 1 trauma center. So you end up seeing a lot of interesting pathology. And then later on, it's nice because you already know the trauma surgery attendings, then we do consults with them as well. We also do some prosthetics, orthotics, and movement disorder rotation, which is really interesting. See some different pathology that we end up seeing in clinic. And then this year we added a specific osteopathic OMM rotation that's done at Cleveland Clinic. So this will be really interesting for our interns to kind of rotate through and really get some good hands-on experience. Courtney, I'm going to throw to you because I am on call.
All right, sounds good. If you can still help advance while you're talking, but all right, I think we're pretty much done with the first year. So second year, like any place, it'll be mostly inpatient heavy. So we do a mixture of, we have 3 different inpatient hospitals that we rotate at through UH. She mentioned Avon's on our west side, Beechwood's on our east side, and then we also have one that's like southwest. So they all serve kind of different populations, pretty different populations, which is nice. We get a pretty good mixture of downtown Cleveland patients and then more rural patients as well. 2 of them are freestanding hospitals, so you kind of get what it's like to be freestanding with IM consulted, and then one of them, our Parma location, is within the hospital, so you can have many different more consults with cardiology, nephrology, things like that. So you kind of get a mixture. All 3 of those are just a mixture of different inpatient patients. We don't have specific floors for stroke, spinal cord, things like that. It's just kind of a mixture of everybody. So that takes up, I think, about 6 months of our year. We also have prosthetics and our orthotics rotation our second year. We do 2 months of spinal cord injury at the VA. Those are our 2 months of dedicated spinal cord. Since we don't have our own unit. We do a month with Dr. Swirls we talked about earlier. We're doing outpatient procedures. We're doing a lot of ultrasound injections our second year. And then we're also doing interventional spine our second year as well. So it's nice that we're able to start doing injections, get numbers, get hands on the needle, things like that, starting our second year. And we work with all of those attending second, third, and fourth years. So every year you kind of get more autonomy doing more and you get to know them well, which is nice. So after second year, we advance more to kind of a mixture of both inpatient and outpatient. So right now I'm a third year. We have probably about, I think it's 3 months of inpatient, and then the rest are a mixture of peds, outpatient. We do 3 months of EMG our third year. Those are pretty much the highlights of third year. But Kristen, since she's back, she can go fourth year.
All right. Sorry about that. You'll soon realize the fun things about being a resident on call. So yeah, fourth year is really fun. You do a lot of outpatient. So you do a lot of interventional spine. It's the time where we get to do some electives. So I'll do some pain management this year because I'm interested in pain. You'll do consults at our downtown facility. So that's where we are asked to give recommendations and determine if patients are appropriate for rehab. So like I mentioned, we do a lot with the trauma surgery team, the stroke team. So it's really good camaraderie, and you get to see a lot of good PM&R pathology. And then I'll have cancer rehab coming up this year, sports medicine. So fourth year is really outpatient heavy, which is nice, but you have electives, so you can choose to do inpatient if that's what you're interested in doing. Courtney, you're muted. Sorry.
Thank you. So this is what I was talking about earlier. This is one of our inpatient rehab hospitals. Looks really nice. It's beautiful inside too. Patients love it. But it's general inpatient medicine. So again, we see a mixture of a lot of strokes, a lot of hip fractures, a lot of amputees, some spinal cord injuries, not as severe though, a lot of trauma. A lot of these come from our main campus site. So we see a lot of the trauma that comes in, level 1 trauma center. We get a lot of those and a lot of strokes. So it's a good variety. It's kind of where we spend our most time, second and third year. And it's also where we take our call, which I think we'll talk about later. Go to the next one. And then this is Avon. Again, this is far on our east side, and then Parma. So Avon up above, it's similar. You see a lot of stroke, kind of hip fractures, general debility, also some amputations and things like that as well. And Parma attached to the Parma Hospital. Smaller unit, but again, similar, and you're attached to the hospital. So you get the benefit of seeing what it's like to consult different specialties when you need. All right, we'll go to the next one. And these are just all of our kind of people we work with. Case Western, we do didactics with Metro and Cleveland Clinic. We do some rotations through them as well. I know we do our peds at Cleveland Clinic. We go down to Akron's for our peds rotations. And then again, we work at the VA for spinal cord injury and EMGs as well. So we're kind of involved in all those places throughout Cleveland. All right, and then call schedule. So our call is not too bad. We do home call at our Beechwood location. So our home call, it starts on Friday at 5 p.m. That's why Kristen had to take a call, because she's on home call right now. So you're on call from 5 p.m. on Friday until 8 a.m. on Monday. And you just have to be available by phone. And then we go in over the weekends on both Saturday and Sunday, and you see new admits, anybody that's come in the day before, and then any follow-ups that need to be seen. So typically it's shorter than a normal workday would be. Kind of depends on how many people need to be seen, but overall it's not too bad. We don't do anything first year. Second year, we are about 8 weekends with split major holidays. And then every year it gets fewer and fewer. So 6 our third year, and then only 3 our fourth year. So really it's not too bad. No weekday call, no 24-hour in-house call or anything like that. So not too bad. And then recently, I think a year or two ago, we started the continuity clinic. So we have kind of 2 different pods, groups of 3 of us, and we're on every other Friday for our continuity clinic. And it's just a way to, see our own patients, kind of follow up with them. It's a good way to follow up with patients that we see inpatient as well. It's right down the road from our Beechwood location. So a lot of the stroke patients and amputee patients that might not have good access to physical medicine and rehab doctors, it's a good way for them to follow up with us, and then us getting kind of seeing that population of patients and getting the autonomy.
All right, I'm going to talk a little bit about our education. So like Courtney mentioned, first year, we do didactics with the family medicine and the other transitional year residents that are in the area. So it's really focused on kind of studying and passing for that COMLEX Level 3 or USMLE Step 3. And then once those are taken, usually most of our residents will take it before the halfway mark of their first year. Then you can start to come to our PM&R didactics, which is really nice, because then you get those repetitions, get to see the material a lot more. And let's be honest, PM&R didactics are way more interesting than just general medicine. And then PGY 2 year through 4, we do didactics on Thursdays. So we do this with Metro and Cleveland Clinic, which is really unique. I don't know of any other programs that have so much camaraderie between programs. So we get to see these residents all the time. We do journal clubs with them. We do social activities. So that's really cool. Our didactic schedule is on an 18-month cycle. So it's nice because you get exposed to everything at least twice before graduating and taking boards. We've got a really robust ultrasound didactics. Previously, it was quarterly. We're going to start doing it monthly now because we have a lot of interest. And each of the years of PGY 2 through 4. So we have 3 handheld ultrasound machines, so you can take it home, you can practice. And we get together and use these really nice machines and get lots of hands-on ultrasound training. Something I think that's really cool and probably unique to our program is that our PM&R department sends the PGY 3s to the AA PM&R STEP ultrasound course. Now, when we went last year, so this is a picture of me and the other PGY 4s, we were the only residents in this ultrasound course, and it was really cool. It's very in-depth. It's the part 1 of it, which I think there's 3 parts for you in order to get ultrasound certified. So that was really helpful, and it's really helped our ultrasound skills this year. And also we stayed for the rest of the conference because our program will pay for you to go to any conferences that you are presenting research at. All right, some other study resources. Our program gives everybody PM&R recap our second year and gets it for a long enough time that you will have it through when you take boards after you graduate. We also get $1,000 every year to use on education. So a lot of us we'll buy different study textbooks. You can spend it on a lot of different resources. You can spend it on if you want to go to conferences that you're not presenting at. And then we also, our PGY 4-year, we get $1,000 to use towards board prep and resources. So our program is really focused on kind of that educational aspect, which is nice. So like I mentioned at the beginning, we are osteopathically accredited. So we get many opportunities to practice OMM, and this is kind of, you can make it what you want. Andrew, who's pictured in the middle picture, is one of our PGY4s who's super interested. And so he has gone out of his way to set up this OMM rotation that's done at Cleveland Clinic. We also do quarterly OMM didactics with Dr. Wayne, who's pretty well known, and he teaches at LECOM. And then Andrew has almost completely filled his resident clinic with OMT patients. So it's really nice to be able to have that extra skill as part of residency training.
5
Just
minutes
about,
for me.
okay. Just some other things I wanted to point out is we have lots of sports medicine opportunities. There's tons of sports teams in Cleveland. And so one of our PGY2s and one of our PGY4s have their own high school that they do sports coverage for. So they're the only residents, they're the only attendings kind of on, or not attendings, doctors on the sideline. So that's really cool. I've gotten to help with some weekend race coverage. And Andrew, who's listed in this picture, got to do a really unique opportunity, which is he got to go to the Browns training camp and do concussion testing for them. So we have really good connections with sports medicine, if that's what you're interested in.
All right, and I'll just run it out by talking about Cleveland. So disclaimer, I'm originally from California. So anybody that's from warm weather, don't be scared off by the Midwest. I promise it's not bad. We have all 4 seasons, which is beautiful. This fall, the leaves are starting to change already. It's really fun just having all 4 seasons, and it really doesn't get that cold, and doesn't really get super hot in the summer. So it's really not bad, but it's beautiful. It's right on Lake Erie, so you have some beaches kind of right along the water. Lots of hiking areas. There's metro parks all around. Here's boating. I know. Prior to when we were there, our program director took some of the residents out on his boat. And here's the famous Cleveland sign. We have lots of sports teams to watch. The Guardians, Browns, or the Cavs were there, I'm sure. We have a really big theater district. I know it's like one of the biggest theater districts. So if you're into performing arts, there's always something fun going on downtown as well. It's really a growing city. There's the zoo. I'm actually not sure what that is on the right. I can't read it, but so there's really always something, there's, something for everybody. There's a downtown if you want to live kind of in the big city life. There's suburbs, there's more rural. Here's all the beautiful kind of rivers and trails and things we have. So it's kind of a mixture of everything, and don't be afraid by the cold weather. That's what I'll say. Any questions from, we only have a couple minutes left. There haven't been any questions in the chat either. Oh, let's see. It says, I don't know. It says, Kristen, do you see that? It says
Required away rotation. Will someone's application be disqualified if they did a couple, but no away? No, that you wouldn't be disqualified. I'm not sure why the ERIS says that. That doesn't make any sense. But yeah, if you've had some exposure to PM&R, that's totally fine. What made me pick the program? Do you have any application tips? Let's see. So I did my clinical years, so my 3rd and 4th year here, and absolutely love Ohio. It's not home for me either. I'm from Utah, so this is very different from where I'm from. But I came and spent a day with Dr. Schaefer, who does interventional spine, and he let me come into the OR with him, and I just got to spend some time with him. So he's great attending. I think that a lot of our strengths, we have really great outpatient exposure. So if you're looking for a program that's going to make you really good at ultrasound, good at any kind of interventional procedures, like I mentioned before, I'm interested in pain. So I'll find out in a few weeks if I matched in pain. So yeah, this program will prepare you for any kind of fellowship you want to do in the future, or just general PM&R practice.
It says, do you have any community outreach opportunities within here? I mean, Cleveland's a big city. There's 3 major hospital systems, us, Metro Health, and Cleveland Clinic. So there's always, you know, there, if you're interested in something, then there's always opportunities. We have a lot of sports kind of outreach opportunities. I know some people, I've talked to people at Cleveland Clinic, and they're interested in more of the Special Olympics or Paralympics. So there's opportunities with that as well. Yeah, if you're interested, there's something that you can help with here.
Yep. We always get more emails about opportunities than time that you have for things. So, all right. Well, thank you, everyone. We will take it back to the moderator.